Epidural anesthesia.
Oh, here comes another one.
Okay, take a nice cleansing breath.
Some women need or want to have more pain relief than narcotics can provide. Not all birth settings, but certainly most hospitals have the capability and medical staff to administer epidurals, the most common form of regional anesthesia. Promoting a near-total loss of feeling in the abdominal and pelvic region, an epidural eliminates almost every sensation of contractions. In the case of a first labor, an epidural is usually not performed until the cervix has dilated to about 6 centimeters. There are advantages to waiting for an epidural because the earlier it is given, the more likely it is to slow labor down. It is administered by an anesthesiologist or nurse anesthetist.
All set?
That's okay.
I'm just going to undo the gown here so I can get at your back.
If you choose to have an epidural, keep in mind that it will be given when you are in active labor. Before and during the procedure, you may find it helpful to use relaxation techniques. Your support person and nurse can help too by assisting you as you curl into the correct position.
Put your chin on the chest.
There
Good.
we go.
I'm just trying to bend over the baby and let this lower back bend out right at me. Good.
More.
Perfect. This is going to be cold and wet.
First, the lower back is cleaned with an antiseptic wash.
And you probably have 3 or 4 contractions as well with getting this epidural in place, and all you have to do is just breathe through the contractions and try to be as still as you can.
Then a local anesthetic is used to numb a small area of your back.
Let it blow now.
You're going to feel a little needle stick and some burning.
All right.
Little stick.
Okay.
Then, with your back still arched like a rainbow, the doctor will insert a needle between the vertebrae about 2 inches into the epidural space. Next, a thin plastic tube is threaded through the needle. This tube, called a catheter, will carry the anesthetic to the epidural space where nerve fibers transmitting pain signals to the brain will be numbed.
Okay, the needle's out and the catheter's in place. I'm just going to take this catheter in your back, and we'll be all done.
When the needle is removed, the plastic tubing is securely taped along the back to prevent it from moving. Then it is usually taped to the shoulder or chest. This allows easy access for repeated doses or for continuous infusion by electric pump.
We're all done right now. You can relax a bit.
Okay.
You did very well.
A small test dose of medication will be given, and when it is clear the anesthetic is working and you are suffering no adverse effects, you will receive the full dose. From the time of the test dose, it may be 30 to 40 minutes until you receive complete relief. When the anesthesia does take effect, you will feel numb from your abdomen to your mid-thighs. Your blood pressure will be taken at least every 15 minutes, and your baby's heart rate will be monitored at all times. You will receive IV fluids to prevent a fall in your blood pressure and to keep a line open should other drugs like Pitocin be required.
Okay, you're all set. I think you'll notice every contraction from this point on getting better from this medication. And it lasts about an hour and a half, sometimes 2 hours. And then when it starts to wear off, you just let us know. We'll come by and give you another dose.
I can already notice a little difference.
Okay, good.
Labor may slow down in response to the anesthesia, and as a result, in some cases, Pitocin will be added to the IV fluid to stimulate labor once again.
Can you feel your legs at all?
Not really. It works so fast.
That's great.
Oh,
That's great.
I'm gonna really need your help when it's time to push.
I'll
I
do
don't think I
whatever I
can move
can.
my legs at all.
In many cases, the anesthesia is permitted to wear off for the pushing stage of labor, which allows a woman better control over the muscles she uses to birth the baby. If the anesthesia is still in effect when it is time for you to push, you may need help from your labor partner and nurse. They can help you hold your legs and give you clear instructions as to how to bear down.
Good work.
Great.
Good work. Now just relax in between.
You okay, babe?
Well managed, an epidural is a tremendous relief to many women. Anesthesia, however, often brings with it higher risks of a forceps delivery, more frequent use of Pitocin to stimulate labor, and other interventions as well. Although little of the anesthetic reaches the baby, you may experience some temporary side effects from the medication, such as difficulty urinating. Long-term side effects of epidural anesthesia are rare, but you should discuss them with your doctor well in advance of labor. That way you can feel certain that the choice you make is the right one for you.